Hello, my name is Dr. Shahad Abulanain and I'm the correspondent for MedEdge MEA at the first annual meeting of the Emirates Clinical Chemistry Society and the Digital Health and Laboratory Medicine Forum held here in the beautiful city of Dubai. I'm very honored to be joined by Dr. Shereen Amer. Dr. Shereen is the General Secretary of the Emirates Clinical Chemistry Society. How are you, Doctor? And thank you for being here.
Fine. Thank you so much, Shahad, for having me today.
How are you finding the conference so far?
Amazing. I'm really so happy with the great success, the number of attendees, the level of the lecture, our professional speakers, everything is great.
So that's lovely to hear. And what did you like most about the conference so far?
The new topics, actually. So in our conference today and yesterday, we actually touched base with a lot of new topics in the field of laboratory medicines and artificial intelligence, including new biomarkers for brain damaged Alzheimer's disease, the role of artificial intelligence in management of clinical laboratory and point-of-care medicine. There is really a lot of new topics discussed in this conference.
Definitely. It's very enriching.
It is.
Doctor, can you kindly also introduce yourself to our listeners before we get started?
Yeah, definitely. So I'm Dr. Shereen Amer. I'm a consultant clinical pathologist and I'm General Secretary of Emirates Clinical Chemistry Society. I have been working in UAE since 2006. So I came to this country maybe 20 years ago, 2006. And all of that time, when I met my colleague in a conference or a meeting or a scientific meeting, we were speaking about having a committee that is encourage the field of laboratory medicines and ensure making all our professionals updated in this field. And here we are today. Currently, I am working as Associate Director of Georgia Public Health at USA, but I'm still holding my position as General Secretary of Emirates Clinical.
That's lovely to hear, and I'm sure this meeting is a great success because it serves the same message you wanted when starting the Emirates Clinical Chemistry Society. So, Doctor, since you're an expert in laboratory medicine and pathology, let's talk more about traumatic brain injury. Yes, you can please define it to our audience, what it is.
Yes. So let's first just tell the people what is the meaning of traumatic brain injury. So it is non-degenerative, non-congenital damage of the brain that results from external force, like falling or car accident or sports. And it leads to maybe transient or permanent change in the function of the brain, the physical function, cognitive functions. Usually it is associated with determination or deteriorations in the level of consciousness. So some of patients lose consciousness, the other are not. We know that this kind of injury are very common, and we estimated the number of about 69 million injuries admitted to the emergency department every year with traumatic brain injury. The most important things here that we know also there is something called chronic traumatic brain injury. So there is certain group of population at higher risk of having repeated multiple traumatic brain injury, like for example children. They are fall every time on the floor, athletes, football players, people working in army, in the police. And recently we found that multiple traumatic brain injury will lead to psychological disturbance of the brain. It may be manifested itself in the form of depression, regression, agitations. And I'm not sure if anyone remembers the story of the famous football player Dan Davison. Dan Davison, he was suffering from depression during his late life, and his family complained about changing of his behavior, and he ended his life by himself in 2011. After this, the family donated the brain for research to Boston University, and the result came positive with chronic traumatic brain injury. So what happened to them with the results of a chronic traumatic brain injuries?
Thank you for shedding light on that, because we often overlook the psychological impact of diseases, and sometimes they're more profound than the disease itself.
True.
So, Doctor, can you tell us more about biomarkers? Since biomarkers is discussed a lot in the conference today, does it play a role in traumatic brain injury management?
Recently, actually, there is a great improvement in the role of the biomarker in traumatic brain injury. So let's follow the journey of the patients after getting like trauma. You call the implants will transfer the patient to the hospital, and then he will admit it to the emergency department, and then the physician start to examine the patient and categorize him according to scale called the Galas-Kokoma scale. And this scale is a tool used by the healthcare providers to determine the level of your consciousness after brain damage. And we categorize the traumatic brain injury into mild, moderate, and severe. There is a slight overlap between the mild and moderate traumatic brain injury, but severe is completely different. Usually the patients in a bad condition that require admission to the hospital and intensive care unit. Slightly overlap between mild and moderate traumatic brain injury, and the most common procedures by the physician is to order a CT scan for the patients. And the reason why we order CT scan, if you didn't know if there is any structural damage to the brain or it's just external trauma and something mild. So guess what? From all the patients admitted to the emergency department with traumatic brain injury, CT scan ordered for 80% of them. 80% of 69 million yearly. Was negative result in 90% of those? Yes. So the result of CT scan came negative in 90% of patients with multiple traumatic brain injury. So we need a better tool here.
It's not a conclusive.
Exactly. We need a better tool. We need to make the triage room empty in the emergency department for more serious cases. We need to decrease the exposure of unnecessary radiations because the patient, they are doing CT scan and they don't need to do that. So we need to decrease this. This is the role of biomarkers. So the biomarkers actually help you to determine which patient needs CT scan after my traumatic brain injury and which one
does not. That definitely saves resources, protects the patient like you said.
Resources, time, unnecessary exposure.
Thank you for shedding light on that. Now, what are the most recent advances in the field of biomarkers when it comes to traumatic brain injury?
So today I'm speaking about very important test that's released recently to the market, and it's got FDA approval. And I mean, all of my colleagues will understand what is the approval. It is like tedious process by which this test approved by the Food and Drug Administrations from USA. And this test actually for the first time, it's a point of care testing. So you can use it in the emergency department or in the physician clinic. You don't need to take a sample from the patient and send it to the laboratory to be performed and spending 1 or 2 hours waiting for the result. It is just simple test at the emergency department. Turnaround time, or it is finished within 15 minutes only.
Saves time as well. So,
and you can do it in the ambulance car if the people there they are trained and know how to do the tests or point of care testing. So you are saving the time of the patients and you prepare him for better management after that when he arrived to the hospital. And this test actually can determine if your patients need a CT scan or not, and it's correlated very well with the stage of the traumatic brain injury. So it's usually positive with the cases that show damage with the CT scan and negative if there is no structural damage of the brain. This test is currently available in the market, and we are trying to orient the physicians about the value of this test and how to use it in a clinical setting, either in the laboratory or in the emergency department, ambulance or physician clinic.
It will also definitely help us save time when treating patients, since patients'
time is very important in those cases for the management.
Usually a race against time.
Minutes means life.
Right, that's very true. Lastly, doctor, if you can please give a takeaway message to young professionals and doctors who are interested in the field of laboratory medicine and biomarkers specifically, since it's an emerging topic, what would you tell them? What advice would you give?
I know that you are working in the background, but you are doing a crucial role linking between science and clinical practice. So keep working on improving patients' health, because when you are improving patient health by providing accurate result, accurate diagnosis and follow-up of the patients, we are providing better health to our community and improving the health care.
Thank you very much for your inspiring words and for the great insightful discussion we had. Thank you. I hope you enjoy the rest of the conference.